What is workplace fatigue? Presentation by Tara Young. What is fatigue? Fatigue is a subjective feeling of tiredness. It is physically and mentally draining for an individual when they experience fatigue. Fatigue can range from mild tiredness to utter exhaustion. When a person has fatigue, it can interfere with their physical and cognitive ability to function in their normal capacity. Fatigue is influenced by many different factors. Let's look at the body physiologically and take a closer look at circadian rhythms as an example. For people working in industry who need to work shift work, they are often waking up and going to bed at abnormal times. This change to the circadian system over time can lead to fatigue. Psychological demands that cause stress, alertness, and sleepiness can also lead to fatigue. Behavioral routines such as patterns of work and sleep habits, or environmental factors such as work demand, also contribute to increased tiredness. Compassion fatigue is a form of fatigue often experienced by those in the healthcare profession. These are people such as physicians, occupational therapists, or nurses. Compassion fatigue is a term that encompasses both burnout and secondary traumatic stress. It results from work-related exposure to stories of stressful events that happen to other people. The definition of burnout is a syndrome of emotional exhaustion, depersonalization, and reduced personal accomplishment. It is characterized by psychological distress, feelings of dissatisfaction, impaired interpersonal functioning, emotional numbing, and physiological problems. Burnout is also associated with caseload size, institutional stress, and managing a work-life balance. When an individual burns out, they often appear to have low morale, impaired performance, and absenteeism. Emotional exhaustion is often accompanied by physical exhaustion, illness, psychosomatic symptoms, increased use of alcohol and drugs, and increased marital and family conflict. Now let's take a look at the profession of occupational therapy and its link to workplace fatigue. A study was completed showing that 47% of OTs found that most of their days at work were quite to extremely stressful. OTs were ranked as the 7th most stressed healthcare provider behind nurses and physicians. Some key factors leading to increased workplace fatigue for OTs include demands on time, lack of autonomy, and lack of respect. Regarding demands on time, many OTs reported a large workload as the main practice issue they struggle with on a daily basis. Challenges include juggling a wait list, working overtime, and feeling pressure to discharge. Regarding lack of respect, some OTs are forced to provide constant justification for their decisions to managers or other members of the team. Coping methods to help promote engagement include setting boundaries and balancing needs of home and work, using time management strategies to maximize productivity, setting goals and priorities, focusing on physical self-care and reflection, as well as being able to say no and turn down certain tasks. Here is a diagram outlining what was mentioned in the previous 2 slides. Occupational therapists need to learn to balance the practice issues promoting burnout with the coping strategies that promote worker engagement. Here is a more inclusive list of suggestions in helping to reduce workplace fatigue. Stress management interventions can include balancing your workload, promoting role definition, or changing your practice specialty. Focusing on client relationships and the satisfying aspects of work, such as seeing clients improve, contributing to program development, and mentoring others, is said to decrease stress. Discussing and collaborating with colleagues and sharing responsibilities on the team are other interventions. And perhaps most importantly, a key way to manage stress is being able to maintain a boundary between work and home. What to do if you need help coping with workplace fatigue? You can try speaking to your supervisor or a trusted colleague, or you could also look into speaking to a counselor for tools to implement coping strategies for excessive tiredness and workplace fatigue. Attached are the key references used for this presentation. Thank you for watching.